Next, we have another resource person with us, none other than Dr. T. Ajayan, sir. He's the coordinator, skill laboratory from Sharda Krishna Homoeopathic Medical College. He's also the professor and HOD in the Department of Practice of Medicine at Sharda Krishna Homoeopathic Medical College, Tamil Nadu. Welcome you, sir. Please take over the session.
Just a slide change here. Just with,
yes.
This one. Madam, slide change is like
Green
this.
one, green one.
Green, this one. This one.
Green.
This one. Okay. This one. Oh, this one. This one. Good afternoon. I know they are all eagerly wait for lunch. Yes, I know. Therefore, I wind up my section within 15 minutes because before lunch, one more section is my section. You know the role of the skill lab in our day-to-day practice. Then after arriving our new curriculum, then again the role is very high. There is the skill related to the skill lab. Then before that starting, just the gratitude I convey to our then MCI leaders, then give me an opportunity to discuss with you regarding our skill lab. As you know the background, then skill labs are already is held for. Lab is designed with the objective to teach and assess the learners at all levels, even the first year and medical to the postgraduates and the paramedical staffs. The infrastructure includes the models, mannequins, and ICT facilities. The skill lab will aid the students to practice the clinical skill to history taking, physical examination procedures, communication, and interpersonal skills. Then before that, our then Pavaskar sir, then so many then regarding related to the hospital, maybe even the premises, even the start from a patient is arrived in our hospital, then maybe we are facing the emergencies. Then what is the role of the skill labs in our hospital is, then not only we are trained to our students. In addition to this, even the paramedical staffs and other staffs we are trained, that time only we are immediately attend that case. Our best example is the basic life support, our CPR. Then what is the simulation based then in scope? Then it's actually is an artificial representation of a real world. Everybody know there is so many limitations in our hospitals, then even the enough number of the patient is not there. But this type of the learning method is there, that definitely even the, that means the more critical situations we are facing, the time then we are trained in mannequins, then definitely we are able to save the life of the patient. Then in our simulation based learning is an artificial, is a representation of a real world. Then why the simulation is based the learning? That is to prepare the practitioners for the wide spectrum of the real life medical challenges by allowing them to gain the exposure to the wider variety of the cases that may be less frequent in clinical setting. Then additionally to witness the live presentation of a range of acute emergency situation. Then use the mannequins to execute the basic life-saving technique and provide the diagnostic procedure training. Then experiential learning for the analytical thinking and the problem solving. Then like other methodology, then a simulation have its own, then strength, weakness, and the threats are there. That is an strength we are discussing, the simple and infinite to assess. Then is a knowledge acquisition is an then good for the students level training and the low risk and cost. But then opportunities and advisable for the procedural practice, then is useful for examination and evaluation. Individualized learning is a great advantage. Individualize the learning, then control environment. That means we are creating the situations. There is a control environment. This very useful for us. Then no consent to the legal formalities. Even in the, we are trying in our patient, definitely we are need the consent. Then the practicing the management of the rare procedures. Then because, and after starting, then you know, in our college, we are starting the, before the starting the new curriculum, even the 13 years back, we are starting the simulation-based learning. That is, we are starting the skill lab. Then after that, we are able to develop the so many facilities. For example, for the learning purpose, we are starting the mini ICU. Then in mini ICU is useful for us for to treat the few casualty cases. I will show you. Then the challenges that are threat, the like other learning methodology, there is no realism. Then because in homeopathy, then you know the role of the mental symptoms, but we are not able to collecting from there. The basic case taking and the symptomatology is missing. These are the certain challenges related to our simulation-based learning. That is, then the statistics are shows we are consider other learning methodology, that is in lecture, then reading, audio, visual. The respectively, that is a 5%, 10 to the 20%, but the retention rate of then simulation-based learning is more than 78%. The practically we are doing is that their value is very high. Therefore, the simulation-based learning very useful for our students. Then, you know, the types of the simulation medical education, there are 4, the task trainers, the computer-based learning, then mannequin-based simulators, and standardized the patient. Then task trainers means there are few, that is mannequins, we are simple mannequins we are used for the training. Then the second one, the computer-based learning, is then supposed to be after the briefing, any difficulties we are facing in the trainees, there we are directly going to the computer lab, and there we are provided the so many audio-visual, that means videos, then PowerPoint, etc. With the help of the computer, they are able to learn. That is, I say that is a brush up. Then third one is the mannequin-based simulators. The mannequin, that is highly sophisticated mannequins we are used. Then supposed to be the physiological functions like laughing, then crying. Then nowadays and available, the so many highly sophisticated mannequins, they are act the same level they are acting. Then the standardized the patient means that is a normal man is act like a patient. Okay, these are the types we are used in our skill labs. The methodology isn't very simple. That is, I am not going to the details, but the core areas are just you remember, that is exposure, sequence, and feedback and repetition. This is a methodology we are adapted in our skill lab. That is, the exposure means we are selecting the modality. Then the sequence means that is an advantage of the skill lab, the simulation-based learning. Then suppose 1 or 2 times we are, the trainees make mistakes. Then again and again we are repeating, that time we are equipped, that talent we are able to, that skill we are able to develop. Then we are immediately we are take the feedback. This is another advantage of that is skill-based learning. Then simulation learning. Then frequent repetition. These are the advantages. These are the core area of the simulation-based learning. Then we are already discussed the sequence, then preparation, then conduction, and finally debriefing. Debriefing means we are checking whether we are equipped or not. They are equipped our skill or not. That is the debriefing session. I will show you. That is the method. That is here identify the learning methodology. Identify the objective. Then you know, then our competency-based learning, we are divided into sub-competency. Then sub-competency, then again we are divided into the specific learning objective. The specific learning objective only helpful to work out what type of method we are adapted for the teaching. Then suppose then here, that means the teaching means the simulation-based learning means we are developing our psychomotor skills. There are 3 areas here in our the Bloom's taxonomy. We are says the cognitive level skills we are developing. Then the second one is the psychomotor level skill is developing, and third one is the affective level domains we are developing. The skill we are developing. Then this mainly we are focusing on the developing the psychomotor skills. The first one is we are identify the learning objective. That is, and based on the SLO, there are 12 subjects is there. Each and every subject they are on. They select the specific learning objective. That basis we are use the particular the simulation based practice. Then again we are simultaneously we are take the feedback. The feedback is good. We are trying in our patient. The patient, again, we have to take our feedback. The feedback is good, we are competent for that particular procedure. This is the methodology. Okay, that is to whom? Then our college, therefore UG, PG, the interns, medical officers, practitioners and other college students. Then here the practitioners, the medical officers are very, very important because we are first time we are approach the patient. Then majority of the medical officers, their duties, you are sick on the casualty, the management of the casualty cases and emergency cases. For the management of acute cases, definitely this lab is very useful for us. Then again is our skill lab. Our name is Homoeopathy Medical, Sharda Krishna Homoeopathy Medical College, Skill Development Center for Communication and Clinical Practice is our center. Actually, this center is started around 12 years back. We have started. Now we are then upgrading. This is an old one. That time, then we are our MCI insisted only a very little room is enough for you. We are starting the skill lab. Suppose your demand is there, that time we are able to develop our own skill lab. That means we are related to your subject wise, what are your need at that basis, again and again we are developing our skill lab. Okay, this is the first one. Now we are, our SDBCC center is like this. The structure is, the first one is the virtual lab for the briefing session. Then second one is virtual lab 2. This we are used for the telemedicine, the clinical skill training room, clinical simulation based learning, the debriefing session, the clinical simulation room, that is a media and communication. It's in our skill lab. There is an infrastructure now we are rise is not need for us. Now we are rise to 3,500 square feet areas we are used for the simulation learning. The next we are trying to start the departmental the simulation based learning rooms. Then there are 7 rooms are there. Then our equipments, these are our equipments we are provided in our skill lab. Is not only related for the particular subject, all the subject related, the mannequins we are provided there, equipments we are provided there. Then another very important one is in our skill lab, we are provide the software to facilitate e-learning in medicine. SKHMC has initiated the local chapter of MBTL, a joint initiative for the government of India. The e-learning project provided with the portal for online the curricular materials and related applications which are accessible via the internet for SKHMC database. They are also used for our skill lab. Then for the staff, there are trained staff is there. There are training from the different medical colleges, especially from Amrita Institute of Medical Science. They are then the trained staffs also there. Then department wise also the staff is there. They are supporting. That is, and actually in our staffs are supporting to other simulation. Then suppose a topic is there, regarding a procedure is there, these staffs are here for that other teachers. Okay. This is a briefing session. There is a brush up section, virtual lab 2. Then suppose after the briefing, any doubt you are raising, then you are directly going to this lab and we are with the help of these video clippings, they are able to study. Is in our training, the simulation based training room. Then here we are demonstrate the variety of the clinical skills such as the patient hygiene, the measuring vital signs, intramuscular injection technique, the nasogastric tube insertion, wound management, tracheostomy, and other basic life support. That is an already say, then is a simple mannequins we are used here. Then it's for the CPR, the training. Is for the suturing. Then another lab is there in surgical skill training room. Then for the simple suturing and etc. we are provide the facility. This is a debriefing. The debriefing section means we are checking whether the trainees we are equipped or not. They are got their ideas. They are able to the right way. They are able to communicate or not. etc. we are checking. Okay, that is a debriefing room. It's a real world. Then here the patient is acting like a normal man is an act like a patient is a real world. No need of any relationship, we are already know. Then here, then know how. Know how, that means simply then a case scenario basis the discussion we are starting. Then this in competency based learning. In Miller level, then show how, that is a show how and the does area. Show how means you are developing our psychomotor skill. Then does means the real world. Okay. To perform and the practice. Then our modality is the CPR. The final one is that does means we are doing in our real world. Okay. Then after that, then right assessment is needed. Then normally then OSCE. Then for example, then just remember the CBDC concept and assessment. That is our SLO. The simulation with mannequins. That is assessment method is OSCE. Though for that we are this format we are use. Then is another one. Then for this one we are use the DOP assessment. Then I just before wind up, I show a for the justification that is an outcome is very important. After starting, beginning I say after starting our this one the simulation based learning, we are able to starting a mini ICU. Then there I am. We are able to treat a case. It's a case of the glioma, but it's a critical condition. It shows. I just show this monitor. The monitor it shows then broad, then QRS complex. The broad QRS is complex and with the tachycardia. Ventricular tachycardia is a fatal arrhythmia. This the patient is arrived. That is at that time the presentation is this one. Your immediate attention is needed, but the proper the guidelines basis we are start the treatment. Then it's my request that you need the protocols. The protocol is not there, we are not able to treat the case. And after starting this and simulation based learning, we are able to develop is more than the 14 this one, the protocols. This is one of the protocol for management of this case. Then first we have started. Then after the treatment, we are returned to the normal rhythm. Then there is an advent. Then other the characteristic symptoms are disappear. The patient is survive the more than 8 months. We are able to survive this patient. Okay, is another case of hypoglycemia. And not that this one is just a previous one. Okay, it's a hypoglycemia. Here case we are able to manage. And recently, before 1 week back, this is a protocol we are follow that is for the management of our stroke. Then in a case we are able to survive. It's a case the immediate attention is needed. Then patient is on the left side of the hemiparesis. Then the right assessment is an moderately and severe dysfunction is there. Then the next within 2 days the patient is returns to the mild dysfunction. Then my request is I show all these things and what is reason behind it. Then suppose we are developing a simulation based learning, that definitely we are able to develop in that level. It will help for the more actively we are able to manage the different casualty and emergency cases. The time is over. The last, the patient is able to walk. The outcome of the simulation-based learning is the last one. The training through the simulation-based learning, the enable the effective the management of the critical cases. The trained and get experience in various skill for the skill staffs, paramedical staffs and clinical staffs. Then practitioners gain the hands-on experience in handling the complex situation, then need for the development of the protocol for the future reference, then exposure to the realistic scenario, reduce the anxiety about the new or unknown situations. Thank you all for the listening for this presentation. Thank you.